Can you tell me your name and date of birth?
Tiffany Sullivan, 10/26/1992.
Okay, and can you tell me what day it is?
Friday.
Thank you. And so she appears to be alert and oriented ×3. She appears to be her stated chronological age. Her posture is erect, and her mood is pleasant and appropriate for the setting, and she shows willingness to participate. Her hygiene is clean and she's well groomed, and her nutritional status is adequate. So Tiffany, I'm going to do your vital signs now. Your blood pressure is 120/80. Your temperature is 98.6 degrees Fahrenheit. Your heart rate is 80 beats per minute, and your respiration rate is 18 breaths per minute. Your height is 5 foot 6 inches. Your weight is 125 pounds, and your BMI is 20.2. And so now I'm going to move to assess the skull for contour. It's firm and round, and so now I'm going to palpate the scalp and your hair. Make sure there's no bumps or lesions, and that your hair is not oily or brittle. So now I'm going to do facial symmetry. Your face is round and the facial features are symmetric. The eyes are symmetric, the nose is in the midline, the mouth is in the midline, and the ears. And so now I'm going to palpate your frontal and maxillary sinuses. Can you tell me if you feel any tenderness right here? Right here. Okay, and there's no inflammation there. And so now I'm going to do test for TMJ. So I'm going to have you open and close your mouth. There's no crepitus or clicking. And I'm going to test cranial nerve 7 and cranial nerve 5. So I'm going to have you, for cranial nerve 7, I'm going to have you softly clench your teeth, puff out your cheeks, and squint your eyes, and make a frowny face, and wrinkle your forehead. Okay? And so now I'm going to close your eyes and tell me where you feel soft or hard on your face.
Soft. Soft. Hard. Hard. Soft.
Okay, thank you. And so now I'm going to palpate the lymph nodes. So I'm going to do the pre-auricular, the post-auricular, the submandibular, the submental. Did you feel any tenderness when I did that?
Mm-hmm.
And the cervical node chain. Did you feel any tenderness?
No.
And the supraclavicular. Feel any tenderness there?
No.
Okay. And so now I'm going to start with your eyes and do perla. I'm going to get a pen lock and check that the pupils are equal. And they're both 4 millimeters. And so next I'm going to check if they're reactive to light. So okay, they're both reactive to light. So now I'm going to test accommodation. So I'm going to follow my pen line. Okay, the eyes are well accommodated. And I'm going to test cranial nerve 3, 4, and 6. I'm going to follow my pen line. Next, I'm going to assess the conjunctiva. So I'm going to have you look up for me, down, and move your eyes around. And the conjunctiva is clear and moist. And so next, I'm going to move to the ears. They are symmetrical and begin at the top of the eyes. I'm going to palpate the pinna. Feel any tenderness there? What about on the tragus? Okay. So next, I'm going to use the otoscope to look. And pull the pinna up and back, and rest my pinky on her head in case she moves. And the tympanic membrane is pearly gray. And pull the pinna up and back. And the tympanic membrane is pearly gray. Next I'm going to move to your nose. It's symmetric in the midline. Now you cover one nostril for me and breathe into the other one. Okay, the other one. Okay, and so I'll have you tilt your head back a little bit. And the septum is intact, the mucosa and turbinates are dark pink and moist. And we move to the mouth. Her mouth is symmetrical and in the midline. I'm going to get a tongue blade. And I'm going to assess cranial nerve 10. So I'm going to have you open your mouth and say "ah" for me. The gag reflex is intact. Her mucosa is pink and moist. The uvula moved and the pharynx moved when she said "ah." And her teeth, it seems to be the correct amount, 32. And so now I'm going to assess your neck. So I'm going to have you lay back for me at 30 degrees. And I'm going to inspect your jugular and carotid on both sides. Okay, and I'm going to palpate the carotid. And there's no jugular vein distension, and the trachea is in the midline. Okay, and so I'm going to have you sit up for me. And I'm going to test the range of motion of your neck. So I'm going to have you look this way and the other way, and touch your ear to your shoulder, and the other side, and touch your chin to your chest, and look up to the sky. Thank you. And so next I'm going to go ahead and have you remove your shirt. I'm going to go ahead and assess the skin. Seems to be that the color is even throughout with some freckling and some moles. And there's some freckles on the back. And this skin is tan and appropriate for her ethnicity. There's no obvious lesions. And the temperature is warm throughout. And so now I'm going to assess the upper extremities and make sure that the shoulders are symmetric. I'm going to have you move your shoulders up and down for me to assess cranial nerve 11. And then I'm going to check the elbows are symmetric, and the wrists, and the fingers, and that she's got 5 on each. I'm going to assess skin turgor. It recoils quickly. Okay, I'm going to test capillary refill. Okay. And the color came back less than 3 seconds, so that's normal. Now I'm going to assess the radial pulses. And they're equal bilaterally with a 2+ amplitude. And the hair on the arms is evenly distributed throughout. And so next I'm going to go ahead and inspect your abdomen. So I'm going to have you lay back for me. And I'm going to inspect the abdomen first for shape. And it's flat. And there's some aortic pulsations. So I'm going to go ahead and auscultate for your bowel sounds, beginning in the right lower quadrant. I could listen for a minute in each. The right upper quadrant, left upper quadrant, and left lower quadrant. And I'd listen for a full 5 minutes to declare that they were absent. And so I'll have you go ahead and sit. Oh, wait, sorry. Palpate for tenderness in your abdomen. Do you feel any tenderness through here? Okay, so I'll have you sit back up for me. And I'm going to go ahead and auscultate your heart sound. So I'm going to begin at the left, or the right sternal border, second intercostal space for the aortic valve. Move to the left sternal border, second intercostal space for the pulmonic valve, the 3rd to 4th intercostal space left sternal border for the Erb's point, and the fifth intercostal space, left sternal border for the tricuspid valve, and the left midclavicular line, fifth intercostal space for the mitral valve and apical. And so now I'm going to do the lung sounds. So I'm going to listen anteriorly first in 10 different places. So I'm going to begin here. 2, 3, 4, 5, 6, 7, 8, 9, 10. So now I'm going to listen laterally on the right side. Have you raise your arm for me? And there's 3 lobes on the right side, so I'm going to listen 3 places. 1, 2, and 3. I'm going to listen on the left side. And there's 2 lobes on this side, so have you raise your arm. I'm going to do 1 and 2. So I'm going to have you swing this way for me. And so I can listen posteriorly. And there's 18 places on this side. So I'm going to do 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, and 18. Okay, you can swing back around for me. So now I'm going to move to the lower extremities. And on the heart, I would have been listening for rate and rhythm, S1 and S2 together, S1 and S2 separately, extra heart sounds and murmurs. And for the lungs, I would have noted any adventitious breath sounds such as ronchi, crackles, or wheezes. And so yeah, now I'm going to move to the lower extremities. And I'm going to inspect the hips and knees and wrists and feet for symmetry. So I'm going to have you stand up for me. And I'm going to inspect the symmetry of the hips, the knees, the ankles, and the feet. They all seem to be symmetrical. And so you can sit back down. Sorry. I'm going to palpate the pulses. We'll do dorsalis first. Okay, the dorsalis pedis of equal bilaterally and a 2+ amplitude. So I'm going to do the posterior tibial. It's equal bilaterally with a 2+ amplitude. So I'm going to have you pull your feet in and out and test dorsiflexion. So I'm going to have you pull them up to the sky and plantar flexion like you're stepping on a gas pedal. And can you pull your knee up to your chest for me? And that one. Okay, did you have any pain when you did that? Okay, and palpate the heels. Do you have any tenderness when I do this?
No.
Okay, and check capillary refill on the toes. The color came back less than 3 seconds on both, so that's normal. And I'll have you stand back up for me, and I'm going to test range of motion of your upper extremity. So pull your arm across for me, and back, and this one, and back, and together, and back, above your head. Okay, thank you. And I'm going to have, now I'm going to assess your neurological status. So I'm going to have you walk for me, and back. Thank you. And the gait is steady with arms swinging at the side. And have you sit back down for a second and test your rapid motion. So I'm going to have you do this as quick as you can. Okay, thank you. And then you can put your palms on your thighs and turn them over as quick as you can. Thank you. And then pull this heel up that shin and do the other one as quick as you can. Thank you.